Welcome to our event on applying to public health training. Thank you ever so much for attending. We're delighted by the interest this year. And 2 years ago, when we did this for the first time, we had 25 attendees. And this year we've had over 200 registrations. So I'm not quite sure what may be responsible for the increased interest in public health, can't possibly imagine. But nevertheless, we're very pleased to see you here. We will go through just a couple of minutes of housekeeping while people are arriving. Just to be clear, we are also recording the session. And we will go for a kickoff in a couple of minutes on our first presentation on an overview of public health. So just to go through the agenda again, which hopefully has been emailed to everybody. We'll start with an overview of public health by myself, go on to an overview of the training program by Gabby Morley, and then a day in the life of registrar by Tessa Hewitt. We'll have a short break of 10 minutes and then carry on with a bit more detail on the recruitment process, then go on to talk about some key public health skills and tips for the application process. Finally, we'll have a Q&A at the end, which will mostly be more discussion of some of the key points that you raise in the Q&A function and in the chat. And I'll come on to those in just a moment. But just to summarize all that, what we will try and give you today is a sense of what the training scheme does, and what you can hope for from it, how the application process works. And to be clear, we'll only look at high-level content here. We won't go into detail about the kinds of questions that are asked, but just give you an overall sense of what happens in the application process, and then give you some skills, some of the key skills and some tips of preparation. So some final housekeeping points. At the bottom of the webinar, you'll see that there's two functions, a Q&A and a chat function. So please submit any questions as we're going through to the Q&A, and we'll try and answer those both as we're going along and a bit more depth at the end. And then use the chat to please introduce yourselves, tell us about where you've come from and why you're applying to the scheme, and obviously to make any further comments or discussion about anything that's coming up in the sessions. If you have any issues posting a question that you'd like to see an answer to or discussion, email me at neil.coburn@doctors.org.uk, and I'll make sure that makes it into the discussion. Just to again remind you that we are recording the webinar, so a recording will be available afterwards. We'll email you to let you know how you can access that. If the event goes down, please do just wait a few minutes and rejoin. Hopefully that won't happen. We won't have any technical issues at all. But if it does happen, then we will try and relaunch it as quickly as we can. I'd like to also point out that we're very grateful to the Faculty of Public Health who have supported us in putting on this event and kindly provided access to a Zoom webinar. This is not a Faculty of Public Health event, though. I just want to be very clear. This is not run by the Faculty of Public Health, and we are a group of West Midlands registrars who have put this event on to support people who are applying, and particularly to give information about the West Midlands scheme, if anyone wants that. And so it's not a Faculty of Public Health event. Finally, we will also put a share and evaluation at the end, and we'd be very grateful if you could fill that out to let us know how you found the event and what we can do better in the future. So without further ado, I'll start with the first session of what actually is public health. And obviously this will be more of a what is public health to public health professionals session. So to give my background, I'm currently in my third year of registrar training. I'm on placement in Shropshire County Council, and I'm on the registrar committee for West Midlands. I'm the vice chair. I've come from a medical background, so I trained in the Northwest, and I came straight from FY2. So I'm fresh-faced still. and have a very boring and linear career. Many people have far more interesting backgrounds, but of course, many people also do come in that direct medical route, and we'll discuss some of that more later. So what I'd like to start with is this meme that was presented to me on day 2 of my public health career and has very much stuck with me since, that you might get through the assessment center and maybe even selection center, and you could even hit the jackpot and get into the West Midlands. But especially if you're coming from a well-known health profession like medicine or nursing, you will never be able to explain it to your mother. And it is always hard to succinctly put across what the profession and what the field itself is about. It's not well understood by health professionals quite often. And just the other day, I was asked by a GP, what are public health doing about custody battles that harm children and their educational outcomes? I had much the same reaction then as I am now. I thought it was a very personal question. I said, Lisa, my wife and I don't even have kids, let alone getting divorced. It's not something that's considered traditionally part of public health, but I think that what she was getting at was just as a health professional, as a GP, she saw public health as being the people who solve wicked problems. The people who try and fix those problems that harm people, that have no ownership, but nobody owns them, but nobody is in that position of being the ones to solve, to find the solution and bring people around to trying to change how things work. So public health is wicked problems, a social or cultural problem that's difficult or impossible to solve, normally because of its complex and interconnected nature. Wicked problems lack clarity in both their aims and solutions and are subject to real-world constraints, to real-world problems and policies which hinder risk-free attempts to find a solution, which no organization necessarily will be in a position they want to solve those problems, and it may pose significant risk to that organization to try and solve it. And that's often what people see public health's work as being, particularly in the health sector, that we are there to solve wicked problems. And to an extent, people see us as having a great deal of power to being able to do that. Which, whether it's fair or not, at times perhaps we do have a lot of power. And this man might be familiar to you. This is Anthony Fauci, who is the American equivalent of Chris Whitty. And I'd like to play you this short clip of him perhaps flexing some of his power.
Yeah, that is correct. And Senator Paul, you do not know what you are talking about, quite frankly. And I want to say that officially. You do not know what you are talking about.
I don't think there are many people who would be able to say those words or to make that point in such a public and clear way. So to an extent, there's an argument that public health has power and that we're able to speak truth to power. And perhaps the last 2 years has been an opportunity to do that. And you might argue it's a missed opportunity to do that. But also there are a lot of situations in which we have very little power. And more specifically, that we work in places where there's very little power. And you think of some of the people who public health is meant to work for who don't have power in a way that we perhaps need to advocate for them. And to that end, I'll bring up this image. This is the 2018 winner of the Public Health Looks Like Prize. It's an image competition run by the Faculty of Public Health. And this image was submitted by Laura Finucane. This image won because it captures a lot of, while there are public health issues in the image, what it tells more of is a person's story who is in many ways at the center of much of the work that gets done in public health. This is someone who needs that organized work of society to solve the problems that are causing bad health, and more importantly, that loss of perhaps what it is that people want from life, And often public health is thought of as connected as being important to delivering some of that, despite the fact that for problems that we try to solve, often wicked problems that we can't solve, that we don't make much progress with, and that are far out of our hands. So public health is the big picture, but it's made up of details of individual life stories, of millions of life stories that we're trying to make sense of, listen to, and reshape some part of. But what we're reshaping is less so the individual stories and more the big picture, and how that shapes and forms what people's life stories are. And to use a definition that can be fairly all-encompassing. This is Donald Aikson in 1988, and this in an important report that, to an extent, defined what public health has been in the UK, said that the science and art of preventing disease and prolonging life and promoting health through the organised efforts of society. And I think what's interesting about that definition is that it's more about the practice of public health than it is the problems that we try to solve and the place that we're meant to be. This definition it tries to be all-encompassing about what we do, but not why we do it. And also, I mean, a lot of people would say we've just lived through 2 years of public health, and somehow this doesn't always feel like it speaks to the reality of what happens when public health comes to the forefront. Another more detailed model and an idea of public health. This is from one of the World Health Organization's essential public health functions, and it splits it into enabling and core functions. If you look at the top half of that, there may be many of those are familiar functions. Health protection and health promotion are some of considered some of the core work. Obviously, health protection is very much the core work of what the UK Health Security Agency does, and what PHE used to do, as well as PHE obviously had many other roles as well. Whereas in the lower half of the image, you've got more cross-cutting themes that aren't necessarily owned by public health in the same way. The governance of health, the responsibility for the health workforce, those aren't necessarily held in what people would consider to be public health, and yet they are essential public health functions and capabilities, things that need to be done well for public health to be achieved. And you'll also notice that in this diagram, they don't include healthcare. And not all of these models exclude healthcare in the same way. Many of them do exclude them, though, particularly in Europe and the Eastern Mediterranean region, whereas elsewhere in the world, healthcare is very consciously included. And certainly in the UK, the way we often visualize the practice of public health is in these three pillars of health improvement, health protection, and healthcare public health. And much of that work is done at local authority. Particularly health improvement has long been, local authority has long been the workhorse of that, with much of the health protection function having been done by PHE. But of course, over the pandemic, local authorities have hugely stepped up to doing an enormous amount of health protection work. Healthcare public health was similarly, many functions were in PHE before, and of course local authorities have big roles in that, but now a lot of that's been moved into the NHS in a more permanent way, where previously they were seconded to the NHS and worked more at arm's length. But still, even people who call themselves public health might only be a minority of the actual public health practice that goes on. And to then broaden our view again, to think not just about the practice, but what public health needs to achieve, this diagram, which is deliberately blurred out, is the Dahlgren and Whitehead model. I didn't want to spend too long looking at the detail of it, but I'm sure that there are many people on this webinar who could probably quote the text from memory. It's a very familiar diagram showing the social determinants of health, and those determinants that run from individual constitutional factors and lifestyle factors right the way up to the socioeconomic and cultural conditions in which people live. So this is a hugely broad model of public health and the social determinants of health, which focuses less on the practice and more on what determines people's health. But what really comes out of it is that health becomes everybody's business, and public health is everyone's business. It's not done just by those people who consider it to be public health or consider themselves to work in public health. So while public health is everybody's business, obviously here today we are looking at the registrar training scheme and what the work of public health is that's done on the scheme. And I think that one of the most helpful concepts that I've seen of it, just split it down into two core skills of epidemiology and general management. But those are the two core skills of public health specialists, that they can describe a disease and that they can do something about it. The general management to actually be able to change things, change the way organizations work and services. So those are the two kind of core skills out of a myriad of possible public health functions that the registrar scheme offers as a place to explore that whole public health world while developing those core skill sets. And paired with that are some of the core values, and there are long lists of the different values that are held in public health, but to me I think they come down to fairness and being evidence-based. But fairness, which includes health inequalities and a really strong focus on evening health inequalities, and improving life for those people who are most disadvantaged in society, is really a core part of practice and the way that public health people work in a lot of different settings, but also that they bring to bear evidence-based, and that they try to, from a range of different disciplines, use a factful and scientific worldview to achieve all of those different goals. So I will finish there on our overview of public health, as it's a good moment to then look closer at what the public health training scheme does and what it can offer to you. So I will hand over at that point to Gabby Morley to talk on how on what the public health scheme structure is.
Thank you very much, Neil. Let's just see if I can share my slides. Can you give me the heads up whether that's worked?
That's worked.
Great, thank you. Thank you for the introduction, Neil. My name is Gabby. I am a public health registrar currently in the West Midlands and doing out of programme for research at the University of Birmingham at the moment. I previously was medically trained, and I did my F1 and F2 years in the West Midlands, and I became more and more interested in public health, mostly due to my interest in infectious diseases and antimicrobial resistance, which I'm sort of taking further in my PhD. And as I sort of go into a bit more in this slideshow, you'll see that there is so much flexibility in public health training, which really makes it a very exciting opportunity. I would like to say thank you to Neil for providing these slides, which I've only moderately adapted as he presented these previously. And I'd also like to thank him for being the main workhorse of making this whole webinar happen, which I think we're all very grateful for. And there's over 150 participants now, so I think we should all be very grateful to you for doing that. Thank you, Neil. And also I'd like to thank him and the previous registrars who did these presentations prior to when I applied, and that really did actually help me get in. So I do hope that we will be helpful for you today. So there we go. So just to talk about the training program, it's usually 5 years if you enter at ST1 and you do the Masters of Public Health at this point. However, If you have already completed the Masters of Public Health prior to applying, then you would enter at ST2, and it would be a 4-year training programme. What is interesting is that this is one of the shortest training programs for any medical speciality, and as you'll see, you enter as a speciality registrar straight away. So it's really quite enticing from that point of view. However, there are some hoops to jump through, because within those 5 years, specific outcomes need to be achieved, and there are specific placements which need to be undertaken during the training at specific points in the training. And in addition to that, certainly if you're medically trained, you may know all about competencies and attaining curriculum sign-off points, but that is a really big part of public health training to prove your competencies in order to complete training and propel you to being a consultant. And in the curriculum, there are 10 key areas which include health intelligence use, health protection, health improvement, and other areas such as academic public health. You can go and look at that online yourself. The Faculty of Public Health publishes their curriculum and what is expected of registrars. But just to give you a flavour, this is from the academic public health key area, and it's one of the competencies which you are expected to achieve during your 5 years. So it's to write and submit an article of sufficient quality for publication in a peer-reviewed journal. That sounds quite intimidating, and it can be quite tricky for some people. However, the sort of sign off of this kind of competency starts with a minimal, then goes up to a partial, and then goes up to a full. And actually the full here is that a registrar should draft an article of sufficient standard for sign off by an academic co-authors. And it could be submitted for peer review, but doesn't necessarily have to have been submitted. And I think that just really points to how there is a real element of some subjectivity in the sign-off, and there is a lot of different opportunities for getting different competencies signed off by different placements. And it's often discussed with your supervisor prior to starting that placement, the things that you need to achieve. But it's usually at the forefront of your mind as you go through training. And training is broadly split into two. It's phase 1, which is the knows how, or the knowledge building point of the training, and phase 2, which is the shows how, and is where a registrar would start taking on more responsibility, where they start to do the jobs that they may be requested to do as a consultant. In the ST1 year, if you haven't previously done this prior to starting the training programme, you do the Masters of Public Health in the West Midlands. That's done at the University of Birmingham. And in the ST2 year, it is mandatory to do at least 4 months of health protection training. And then it is also mandatory to have a local authority placement. Finally, in ST5, as would be expected, you are senior in your registrar training, and you are expected to act up as consultant. Usually this would be in a post that you are considering being a consultant in the future, for example, in health protection or in local authority. So the exams, always a bit of a worrying part of any registrar's training programme. It's now changed their names. So Part A is called the Diplomate exam and Part B the membership exam, but to be honest, we all still call them Part A and Part B, just conversing with each other. And the Part A exam is expected really to be taken after the Masters of Public Health has been completed. And so usually for an ST1, that would be in the October. The faculty have changed their dates in the October of the ST2 year. And it would be expected that those who've already completed their Masters of Public Health in starting the training programme would do their Part A as soon as possible, which would be the March of within their first 24 months of starting. But after that point, what is quite nice about public health, and certainly in my experience seems to be more flexible than most other training programs, is that ST3 and ST4 really does give you an opportunity to do the placements that you want to do if you can organise them. And speaking with other registrars, I'm not yet at that point, but there are lots of potential placements available, including in local authorities, acute hospitals, institutes such as NICE, and academic placements such as at universities, or even specialised commissioning placements. And there are also placements which you can do, which are called sort of national treasures, and they are more competitive, but would also contribute to your training. And finally, as I am an example of, you can take some time out of training to do research or to explore other avenues if you want to, if you get it signed off by the appropriate authorities. And just to end, really, this is where you may end up after completing the registrar training, becoming a consultant. There are so many opportunities, so many different consultants in different fields, and it really is one of the most exciting specialities, and something that I certainly would say is worth trying to apply for, because I absolutely love my job, and I'm very, very grateful to be part of the training programme. I will try and answer any questions in the Q&A, and I think hand back to Neil now to finish off.
Thanks very much, Gabby. We don't have too many specific questions that need more of a discussion. So if you do have any more questions directed to Gabby, please do put them in the Q&A, and we can pick them up later in our final session at 3:30 if they need more of a discussion. So at this point, I'll now hand over to Tessa to talk about a day in the life of registrars and what the scheme actually entails day to day.
Thanks, Neil, and thanks, Gabby. So hi, everyone. My name is Tessa Hewitt. I'm a fourth year public health registrar and training in the West Midlands, and I'm chair of the West Midlands Public Health Registrar Group as well. So my current placement is at the Foreign, Commonwealth and Development Office in London, which is something that's possible to do even though it's outside of the West Midlands. You can do it as sort of a national placement. So take some time out of the scheme to do things that are only possible to do at national level, even though you spend most of the scheme in your region. And I don't have a medical background, so I actually have a background in international development. And my undergrad degree was in Hispanic studies with English. So it's been quite a change over the course of my career to end up here. But just to say that don't feel like any sort of background means that you can't do this scheme. There are people who are doing it from so many different backgrounds, and yeah, if you have the right experience, then don't feel like any of that can hold you back. So let me just share my screen. Okay, can everybody see that?
Yep, that's come up.
Great. Okay, so there is no typical day in the life of a public health registrar, because as you progress through the scheme, then you're going to be doing several very different placements. So as Gabby mentioned, what you'll be trying to do is sign off various competencies. And you can do these in a lot of different ways. So early on, then almost anything that you happen to do is likely to sign off some competencies, and later on, then you would be a lot more targeted as you're trying to sign off those that you have left. So most people would start off with a local authority placement. Some people do start off in academic placements, and potentially other placements could be possible, but generally you would do local authority. And if you don't have a master's in public health, then you would generally do one of those in the first year. So that would be something that you do kind of alongside a local authority placement. And then once you complete it, you would generally stay a bit longer at your local authority and then do a health protection placement. So I'll speak a bit more about that later. So most placements that you would do would be sort of between about 4 to 18 months long. So as you can see, there'll be time to do quite a lot of different placements during the 5-year scheme. It's very different from clinical work. So I think for some people, it can be a bit of a shock to take the step back from working directly with patients if they've been working in a medical field before. But the feedback across the board is that people really love the scheme. So I can personally really recommend it. And yeah, people really appreciate the opportunity. One of the nicest things about it is that you can follow a lot of your own interests. So for example, you need to do a health needs assessment, but you can do that on a topic of your choosing, as long as it kind of fits in with what's needed in a local authority. So very often, if there are particular topics that you have an interest in, then you'll have an opportunity over the course of the scheme to spend a good amount of time working on those particular topics. And for those who don't yet know what they're interested in, then there's a huge range of things that you'll end up working on. So you've got kind of the best possible opportunity by the end of the scheme to know what it is that you want to do in the future. So as Gabby mentioned, we would, over the course of the scheme, need to sign off a lot of different competencies. So these are the areas that the competencies are in. So not to go through this in any detail, but just to say that, for example, under key area 1, things that we might do that would sign that off might include a health needs assessment or giving presentations, health impact assessment, that sort of thing. Under area 2, it might be things like doing literature reviews or evidence reviews, briefings. 3, developing a local policy or strategy. 4, you could do presentations, you could do media work, kind of working with teams across different organisations. So not to go through all of them in total detail, but as you can kind of see, they're quite broad. So there are a lot of different things you can do to sign off different competencies. So here are some examples of different placements that you can do. So these are quite West Midlands based. But you would all do some time in a local authority. Often people would do 2 local authorities, so perhaps do one that's rural and one that's urban. Then you do at least 4 months at the UK Health Security Agency, so to do health protection. So that I will come to that one in a minute. You can also do healthcare public health type placements, academic public health, work at screening and IMS, and as I mentioned, you can also do national placements for up to around a year generally, and those are outside of your region. So in terms of an example of a day at the local authority, very often you can do flexible working. So if you are interested, for example, in working from 8 till 4 rather than 9 till 5, then often that's very possible. So for example, at 8 o'clock, you might arrive at your desk, check your emails, look at your activity spreadsheet and just check you're on time with all of your projects and get ready for the day's meetings. At 9, maybe you meet with 2 colleagues to discuss a group project that you're doing. So for example, a piece of work around a systems approach to obesity, which might involve, for example, presenting evidence and contributing to a paper or presentation on the subject. And just planning slides and materials for an upcoming meeting with senior management on that. 11 o'clock, perhaps you attend a meeting related to the commissioning of a loneliness service. Then 12, perhaps you run a lunchtime journal club with other registrars, so you could appraise a paper together, which can be quite helpful preparation for the exams that you need to do. Then 1 p.m. back at your desk, so reply to some emails, catch up on some public health news. Then 2 to 4 p.m. work on an evidence review about an individual funding request, so about a treatment that someone is requesting that isn't typically funded, and looking at the evidence to see whether this is a truly exceptional case and therefore potentially if it could be eligible for funding. And then go home at 4. So that's just an example of what a day could be like, but every day is very different, and it depends a lot on the actual projects that you're working on. So here are some examples of projects that you could work on. So I worked on a sexual health needs assessment in Coventry. That was really interesting. So I was working with quite a lot of different partners to put together all of the evidence on that. So taking information online, looking at changes over time, people involved in lots of different services, and trying to put all of that together so that Coventry City Council could plan what they would do next to address sexual health needs in Coventry. You could be involved in developing and implementing a drugs and alcohol strategy, do the audit of HIV testing. You could be involved in the Director of Public Health's annual public health report. So that's looking at the state of the local population from a public health perspective and looking at any changes that have happened over the last year and what's been done in public health. Then, yeah, so various things here. So in terms of COVID, I was involved in developing a targeted health promotion strategy. So we were looking at the groups that were most at risk if they did catch COVID and trying to improve their health. So that was really in the early days of COVID. So we spent 6 months really targeting certain risk groups. And then once we moved on from this, so I was involved in supporting schools and early years settings on COVID-19 management. So if there are outbreaks in certain settings, then we provide extra support to try and understand what the situation is, if there's anything more that they could do to prevent spread. And things like if certain people should be isolating, if they need to close the setting completely, and just also providing answers to questions that you might get from head teachers or others who are involved to try and keep everything running smoothly. So another totally different placement that I did, so this was actually my first placement, was at Birmingham University. So I was involved in a qualitative study on the acceptability of smoking in a university setting. That was really interesting. So the data had already been gathered. So it's about analysing that, putting it together for a paper. An academic placement can also involve teaching undergraduate students. So I've done some teaching on systematic reviews. I've done some teaching on smoking. But it's a really good opportunity actually to kind of work with students to improve your teaching skills and also to improve your own knowledge of the subject, because nothing works as well as knowing that you've got to teach it to someone soon to get you looking it all up. And then there are also other things that you can do within an academic placement that you wouldn't necessarily think of immediately. So another thing I did was working on an external evaluation of the West Bromwich Albion Football Club's programme to support adults and children with disabilities. So that was really fantastic. So that involved doing focus groups, and working with a lot of different individuals who were involved in it to really understand what they were trying to achieve and if they were achieving it. Also with individual interviews and writing all of that up to advise them on what they could do to make that work better. Then something quite different is a week in health protection. So I can't really say a day in health protection because this is a placement that kind of works over the course of a week, and that you generally spend 1 or 2 days answering kind of immediate public health actions that come in on new issues. So for example, you might get notified of a hepatitis A case and then need to work that through. So this is kind of urgent things and immediate actions that are needed. So that's dealing with calls that come in. So in response to that, as I've put there, then that might involve excluding the child from school, arranging some lab confirmation, and collecting risk factor data. But there are lots of different diseases that might come through on that. And there's also a separate one for COVID now. And then you could also work on what we call patch, which is about following up longer term actions from it. So ensuring that household contacts receive the Hep A vaccination from their GP. So it's not urgent on day one, but it's something that needs to happen fairly quickly. And also checking lab results over time. And you also might have some time to work on a project, which can be very good for your competencies. So something like doing an audit of Hep A cases or investigating outbreaks. So you might need to visit a hospital, to visit a Legionnaire's patient, to do a questionnaire on where they've been and that sort of thing, so that we can hopefully find the source and stop other people from falling ill. So I'm not sure if Neil has seen any key questions from this.
There's nothing I think that needs any further discussion from now. So thank you ever so much for your presentation, Tessa. Please do keep those questions coming in the Q&A and we'll get through as many of them as possible. For now, we'll take a 10-minute break. So we'll start again at 5 to 3. So please do come back and make sure you're ready to go for then. And we'll start to hear from Catherine Shuttleworth a bit more detail about the recruitment process. Thanks very much. Hello again, everyone. Thank you for taking a quick break. We are ready to start up again with Catherine's talk on applying on the applications process itself, which will hopefully answer many of the questions that are coming up in the chat. Just to remind everyone to please put your questions into the Q&A so that they can be tracked and answered and we're not missing anyone. Some helpful points being made in the chat as well. And just to warn you that some people's responses are going to hosts and panelists instead of to everyone. And vice versa in some cases where I have been messaging panelists with messages for everyone else. So please do make sure you're speaking to the right people and putting your messages in the right place, and hopefully we can help you as much as possible. And on this point, I will hand over to Catherine Shuttleworth to talk about the application process. Catherine, when you're ready.
Hi Neil, thank you. So hi everyone, it's great to have so much interest in the scheme, and hope you're kind of looking forward to kind of going through the process. I'm an ST1, so I've been on the scheme for 3 months now, so quite fresh to it all, and hopefully haven't forgotten everything about the recruitment process just yet. So in terms of my background, I completed an undergrad in psychology, and so I'm non-medic, and then went into local authority doing some work in procurement. Then moved into the NHS in a mental health trust doing some project management, and then finally moved into a public health team in Warwickshire, and worked there for 3.5 years on kind of project and programme management work, and also the JSNA programme. So quite a kind of varied route to getting to public health, but it's definitely useful, I think, to have a lot of different experiences in the mix in a public health team. So in terms of the talk that I'm going to be giving, it will be on the recruitment process. So I'll just start that and share my screen with you. Bear with me a second. Right, Neil, is that showing up?
That's come up, thank you.
Perfect, brilliant. So just to give you an overview of what we're going to be talking about, we're going to look at the kind of eligibility criteria, the recruitment timetable, and then the kind of 3 phases of the actual recruitment process. So the application form, assessment centre, and selection centre. So starting off with eligibility, there's obviously the two main routes for medical and non-medical backgrounds. So for those with a medical degree, these are the kind of outline eligibility requirements. So an MBBS or equivalent qualification, you need to be eligible to work in the UK, eligible for full registration with and hold a current licence to practice from the GMC at the intended start date, which will be the start of August in 2022. A minimum of 2 years post-grad medical experience by the time of your appointment. So again, that would be August of next year. And have evidence of achievement of foundation competences in the 3.5 years preceding the advertised post-start date for the round of application. So that's through one of the following methods. So either the current employment in a UK FPO affiliated foundation programme, or having been awarded an FPCC or FACD 5.2 from a UK affiliated foundation programme within 3.5 years preceding the advertised post-start date, or 12 months medical experience after full GMC registration, and evidence to commence speciality training in the form of a certificate of readiness to enter speciality training. For those without a medical degree, or if you do have a medical degree but want to choose not to take the medical route, you'd need at least 48 months work experience, and that's whole-time equivalent. So that equates to 4 years, I think, and that's by the application closing date. So that would be towards the end of this calendar year, and 24 months of that must be in an area relevant to population health practice. The 24 months should be a band 6 or above level. So that's the NHS Agenda for Change equivalent, and a minimum of 3 months need to be at band 6 level or equivalent in the 3.5 years before the intended start date. So I think we'd had a question in the chat around what the equivalent of a band 6 might be, and on the person specification, there's a link to the Agenda for Change website where you can have a look at what kind of constitutes a band 6 role, and you have to kind of map what your previous experience has been based on that. It can be a little bit tricky sometimes working out what that might look like, but I'd recommend perhaps speaking to your colleagues in your current roles, or perhaps HR departments, to see if they could assist with any mapping. So moving on to the timetable for this year. So applications have already opened, and that took place on the 4th of November, and they close on the 1st of December. The assessment centre is due to take place on the 12th of January 2022, and the selection centre, which is also being called the virtual interview, will be scheduled on the 1st to the 3rd of March 2022, with initial offers being given by the 24th of March 2022. So there's a link on that page there to the FPH pages, which I'd really recommend that you have a good review of, and it kind of details a lot of information about what happens at each stage, and there'll be any updates or changes to the either recruitment process or timetable will be posted there. So for example, last year, I think the assessment centre was pushed back because of COVID and the lockdown that was implemented shortly after Christmas. And so it's just worth keeping an eye on all of that. In terms of the application form itself, you'll need to register on the system called Oriel, which is linked through this presentation. That's where all the kind of information will be held that you'll submit to for the application, and you'll need to check through the person specification, which again is linked here, to make sure that you're meeting those requirements and that you can clearly demonstrate that the roles that you've done meet that. For non-medics, again, I think there's definitely sections where you can talk through each of your roles that you're using to act as evidence and state how they relate to public health or population health. It's obviously really going to be important to check the application thoroughly and make sure that you've kind of got all the information that you need to. We also recommend that you don't leave it till the last minute, which I think previous years have had problems in the kind of day or two before submitting to Oriel, just because there's been a lot of applications going in. So I do know that they have got a new system now, so hopefully that might be mitigated, but it is always just best to be on the safe side and get it in as early as possible. And then make sure any documents that you need to attach are attached in the system. So the assessment centre, the invitations haven't, the FPH haven't stated when the invitations will be sent out, but it's normally in, I think, a couple of weeks after the closing date for the applications. There are 3 tests that are covered in the assessment centre, and the first one is the Watson-Glaser critical thinking, so that covers literacy. The Rust Advanced Numerical Reasoning Assessment, or RANRA, which covers numeracy, and then the Situational Judgment Test. And these are done on computers and based at Pearson View Centres. So they've got locations across the country and are often where people do their driving theory test. Obviously, since COVID has hit, they've made provision for remote testing, so it might be worth just considering whether that's something you would want to do, or whether you prefer to do it in person. And I think it's down to the individual of what might work best for them. In terms of preparing for the assessment centre, it's a good idea to think about preparing early, because obviously there's not a very big window between the invite and when the actual assessment centre takes place. And also it's Christmas and New Year, so that's obviously a busy time for people. So we definitely recommend prepping beforehand. There's a website called Job Test Prep where there's a bank of practice questions that you can work through. There is a cost to sign up to that, but it's probably one of the better resources to be able to practice the questions that you're going to be coming up against. If you are invited to the assessment centre, there will be you will be signposted to some example questions on the Pearson VUE website as well. But again, there's only a few of those, and you won't necessarily get the practice in that you might need. The tests are timed, and particularly for the Watson Glaser and RANRA tests, the time is quite tight. So again, would recommend practicing to be able to just get comfortable with the speed and working through the questions as quickly as possible. If you do choose to go to the test centre, one of the Pearson VUE centres, then we'd recommend obviously arriving in good time, and there will be other people who will be at the centre doing different tests. You can get earplugs there, which I definitely made use of, just to be able to block out any of the noise. And be mindful that it's quite strict about what you can take in with you. So you're not allowed to take in any food. The water's provided, but you can't take it in bottle. So just be mindful about that, and have a good hearty breakfast or lunch if you're doing it in the afternoon. If you choose to sit at home, obviously make sure that the area where you're going to be working will be quiet and you're not going to be disturbed, including, if you've got neighbours that might be doing any works, which it's always one of those potential disruptions that could happen. And again, making sure that you prep for video conferencing, so think about the workstation, your background and camera angles and anything like that. I do believe that there's someone on the other side who from Pearson VUE that will check the room and the workstation to make sure that you're working in kind of test conditions as well. So moving on to phase 3, which is the selection centre and virtual interview. Beforehand, again, this is booked through Oriel. So there's the 3 days, I think we said the 1st to the 3rd of March. They'll have a number of slots across those 3 days that you can book onto. So just make sure that you book on early if you want a particular time or day. Make sure that you've got the documents that you need with you. So I think you have to definitely provide photographic evidence of who you are, so your passport, and but they'll outline that in the invitation email. And also consider applying for any reasonable adjustments that you might be entitled to. So this information is taken from the FKFH website, and we're not allowed to communicate too much about the process in order to make it fair for candidates that are going to be taking it. And also we've signed our life away and so that we won't share too much detail of the process, but we can share this, which is that there'll be a digital interview around 30 minutes long for each person, and elements of the selection centre will be scored by trained assessors. For the last intake, they aim to interview about 216 candidates, so that was about 3 candidates per post, and they'll be assessing against the person specifications. So I think recommendation for applicants that get through to that stage would be run through the person specification and really think about how your experience and what you've done relates to each of those points. So yeah, these are more general tips. So again, yeah, running through the person's spec and trying to think about what the interviews are going to be looking for as well. Might be worth thinking about the kind of classic what motivates you, your strengths and weaknesses, and thinking about examples that you can apply to any questions that you're asked. It's also useful to think about getting into the mindset of kind of current public health issues. So looking through the news and different resources such as the Kingston website, the Public Health Matters blog, which I don't believe will be running at the moment, but that was a previous PHE publication, but I still have a lot of kind of really useful information on there. And kind of have a look at podcasts again, if that's how you kind of take information in quite well. Would also advise you to try and relax as much as you can. It is just an interview, so there's the recruitment process takes place every year, so there will be another opportunity if you aren't successful this time. And we do know that a lot of people do tend to get in on their second or third time, and it's just something that you kind of have to work through. If you do get through to the virtual interview stage, then just some general tips about making sure you test your technology. If you're not used to working over video conferencing, then maybe practice with a friend or something, and just kind of run through some questions and role play a little bit. Also think about the setup of the room that you're in, and dress for an interview. So no joggers and tracksuits for an interview, and also think about your body language as well, which can be difficult when you are virtual, but definitely would recommend again practicing with friends if you're not used to that. If you do get through to the following the interview, then you're asked to rank your preferences, and most regions will break down the locations of the starting placement. So they'll put their kind of initial local authority placement that you'll be able to select. Some, such as Yorkshire and the Humber and the West Midlands for this year, don't actually break it down. So you apply to the region, and then following, if you're appointed to that region, then you'll liaise with the deanery to work out which specific placement you'll be in. All offers are made through Oriel and based on your combined score from the assessment and selection centre, and you then get ranked with the kind of first person being offered their first ranked place, and so on until all of the places are filled. You can accept offers with upgrades. So if you get an offer for a place that's lower down in your list, and you want to kind of hold out to see if you can get a location higher up in your list, then you can hold the offer, but you can also just accept offers without, like straight away, without having that option. In terms of feedback, there is some provided. It's not hugely detailed, but can be useful to see where you potentially could work on things for the future if you were unsuccessful. And there is also feedback from the assessment centre as well, which will give you your score for each test that you did. And again, that can be really useful just to see where you might need to focus if you want to continue in the future. There was one more point I was just going to make as well for non-medics and the SJTs. So I think as a non-medic myself, I looked at medical SJTs as well, because the SJTs that are on the job test prep site aren't necessarily as applicable to public health and the recruitment as much as medical tests. So if you have a Google, you can find some past papers on the internet and just have a run through those, and also look on YouTube because there's quite a few videos kind of outlining the SJT process for medics on there as well. So that's it for me now. So I'll just stop sharing. Thank you.
Thank you very much for that, Catherine. There's a lot of questions about the eligibility criteria, which I think is a thorny issue every year. So I think perhaps rather than going into that now, we'll leave that to a bit more of a discussion later, and we'll see what questions are still coming up about the eligibility criteria. So if you still have questions that haven't been answered by Catherine's talk, or sufficiently answered by responses in the Q&A, if you try and add another question in, then we'll make sure we get round to it for the discussion later on. So on this point, I will hand over to Dimitri for our final part of the content. We're looking at some hints at tips to applying to the public health training scheme. Dimitri, over to you.
Thanks, Neil. So hopefully you can see my slides.
That's come up. I think at the moment we can only see, yep, that's fine.
Sorry, I should have loaded from number 1. So the title I was given was Key Public Health Skills. So what I thought I would show is what skills you might develop as a public health doctor or specialist, and what skills you might need in the application process, and how that kind of all melds together. So just a bit of background about myself. So graduated in Birmingham in 2012, did foundation training. I then did a academic clinical fellowship in general surgery, decided I didn't really want to be a surgeon. So had to look around for something else to do. Did a PhD in global surgery, also at the University of Birmingham. And then in my last year of that, I applied to join the public health training scheme. And luckily I was successful and started ST1 sort of last year, during which I did the Masters in Public Health, which is what most people do in the first year in the West Midlands. And I'm now an ST2 in Coventry. So that's just a bit of background. So I think the best way to kind of understand what skills they're looking for in people applying is always to look at the person specification. So that's available online. So if you Google ST1 public health person specification, you'll be able to find it. And it kind of breaks it down into technical and academic skills, and it gives you some bullet points on what they're looking for there. So there's something about understanding about what health and disease is and what the determinants of health are. So really looking at the kind of social determinants of health. Then there's something about inequalities. So obviously that's quite closely related to the social determinants of health, and also health protection. Then there's a bullet point about understanding the role of national policy in terms of public health and how that's made and what its impact is. And then the last 2 bullet points are about understanding the importance of evidence-based medicine or evidence-based practice, and some basics really around research methodology. So how would we go about demonstrating evidence in a robust way, establishing evidence in a robust way. There's also some bullet points about your personal skills, and I haven't copied all of them, but these are, I think, the key ones. So there's communication skills, problem solving, so the ability to handle uncertainties is, I think that's quite an important one in public health, because you often have to make decisions when you don't have perhaps all the information you might like. Obviously, the pandemic is a very good example of where, especially on a national level, people have had to make rapid decisions, and they probably haven't always had all the evidence they wanted. Managing teams, so the ability to work with multidisciplinary teams. This is really important because the likelihood is you'll be working in a team that includes representatives from very wide backgrounds. So even within the public health team, there'll be different professionals working there, but very often you'll be working in a multi-agency, multidisciplinary setting. So you might be working with head teachers, you might be working with environmental health colleagues, might be with business owners. So people coming from very different backgrounds, who come with different priorities, different perhaps ways of thinking about things. So how do we kind of bring all of that together in a constructive way? That's really, I think, the core of what public health is all about, trying to work in a team using your soft power, because you very rarely have the hard power. You can't tell people you must stop smoking or you must implement this or that. It's really, how do we persuade people that we can work together and align our priorities so that we achieve whatever it is that we're trying to do. And that again is about leadership, but it's a different kind of leadership, because you're probably not going to be the line manager able to tell people what to do. It's more about these soft leadership skills. Organization and planning, so prioritizing time, that can be really important, because you know, you kind of imagine that you sit there in an office or a home, and you've got all day to do things, but if by the time that you've read all the 100 emails that have come through each day and reply to those, you find your time slipping away. So it's really important to be able to manage your time effectively. Demonstrate preparation. Well, I have to say, I got the date for this webinar wrong. I thought it was on Thursday, so I had about 20 minutes to put some slides together. So clearly, managing your diary and preparing for meetings is important. So I'm sorry about that, Neil. Capability to work with long timescales. So I think this is particularly for people coming from a medical background. We're very used to things happening quite quickly. You know, you give somebody a medication, you do an operation, people get better. With public health, we're often looking at very long timescales. We're looking at things changing not in the next day or two, and not even in a period of months, but often years, or maybe even decades. So it's sort of having that mindset that we're not going to see an instant change from the work we're doing. You know, we might have changed jobs before any kind of benefits come from the work we're doing in a particular placement. Coping with pressure. So I think being aware of your own limitations is important in any role, and being able to adapt to changing circumstances, often the case in public health, of course. And then there's a section on commitment to specialty. So being able to demonstrate your previous experience and how that's relevant to public health, having some insight into what public health is all about, understanding of public health principles. So these are the kind of bullet points they have. Note this is quite different for those who come from a medical background to other medical specialties. There's very little specific criteria. There isn't a criteria to say you must have done a master's in health, or you must have done Part A exam, or you must have gone on these particular courses or had these particular experiences. All of these bullet points are quite broad and a little bit vague, because of course people come to public health from a lot of very different backgrounds with very different experiences, which are actually all very useful and valid in public health. So there's lots of different ways of demonstrating these bullet points, if you like. However, what I would do is, as you prepare your application and prepare to go to the interviews and things, look at the bullet points and just think through, well, what prior experience have I had that might demonstrate how I meet these requirements. So what I thought I would do next is tell you a little bit about what I've done a little bit before and during the training program, and how that, if I was applying now, I might use that to demonstrate these skills. So COVID response, I spent some time last year at Public Health England, and then several months this year in Coventry. Tessa will know all about it because she was there before me, working on the acute COVID response, which was largely tracking where the COVID outbreaks were happening and trying to respond to them. So giving people advice on how they might reduce the likelihood of future outbreaks, helping them with the contact tracing, making sure that the initial actions that need to be taken when there's an outbreak have been done. So those are the technical skills I would say that, you know, doing this role, and those of you who are currently local authorities, some of you I'm sure have already been involved in this, it would be saying that, you know, there's some kind of principles of public health protection that you're implementing. But there's also personal skills involved in that. So, you know, particularly in September, when we had a lot of school outbreaks, how do we prioritize which outbreaks we're going to get back to in what order? Because actually, the number of outbreaks we were having, it's not possible to respond to all of them in a detailed way. So how are we going to prioritize those? Again, it's about working in a multidisciplinary team, and that would be with colleagues in the council. So that would be with education colleagues, environmental health officers, regulatory services, but also with the wider health system, or we should say wider system, which would involve, for example, head teachers. So communicating with those senior stakeholders, so communicating with business owners, spelled wrong on the slide, and head teachers. So that's a bit of a skill set, you know, for someone like myself. I'm probably not that used to speaking to people who lead a large organization. So that's certainly something that you have to learn how to manage them and make sure that they are going along with your agenda. And then, of course, it's escalating issues. There's always difficulties, things you're not sure about, things you're concerned about. So escalating appropriately to your senior colleagues so they can address that. Just another example. So during my PhD, one of the things I was involved in was a randomized trial called Falcon, which was randomizing patients to different interventions aimed at reducing the likelihood of wound infection, which were different types of skin preparation and different kinds of suture. So that some of you might have seen was in the Lancet on a Friday. It was a great experience. Actually, I had an opportunity to work with a very wide range of colleagues from around the world, in Mexico, Nigeria, Ghana, India, South Africa, Rwanda, and Benin. And so what you learn from this, well, something about understanding evidence-based medicine. So why are we doing a trial? To understand which of these interventions are effective in reducing wound infection. Also about the cost effectiveness. As it happens, the expensive interventions did not reduce wound infection. So the lesson there is we can save money by not implementing interventions that are very expensive. And then understanding research methodology. So, you know, how do we design a randomized trial? How do we deliver that on the ground? How do we analyze the results and publish those? Again, personal skills, so communication skills. So I was privileged that in some of the work I was doing, I got to visit some of our collaborators around the world. And, you know, that's a different kind of communication skill. So how do we work with colleagues from very different cultures, very different settings? That's a key skill. Teamwork skills, again, big project, working with lots of colleagues of different seniorities. How do we work together to ensure that we deliver this project? Long time scales, again, because this is something you're going to deliver over a 5-year period. It's not going to happen very quickly. So contributing to long-term project. And there's something about here about, you know, understanding public health. Well, global health is part of public health in some ways. So I think you can say something about that. COVID surge. So during my first year, I was doing the MPH, which one of the good things about the MPH is you get quite, or at least when we did it, we got quite a lot of downtime. And so working with my colleagues in the Department of Surgery in Birmingham, we did a whole series of studies looking at outcomes of surgery during the pandemic. And the first study we published here was just 1,000 patients around the world with COVID who had surgery. And what it showed was that their mortality rate was really high, 24%. And I think this paper, which was in the Lancet as well, was quite influential in changing people's practice during the pandemic, because it really showed that it probably wasn't a great idea to operate on people with COVID if it wasn't urgent. And obviously, if you have an emergency, that's a different situation, but not for routine surgery. And then we collected data on about 190,000 patients in total over last year. And we've even got a Guinness World Record certificate. So that's all great. And then the other thing was that we worked very hard with our international team to try to disseminate the findings, both through sort of mainstream media in terms of newspapers and radio and television, and also into evidence-based guidelines for sort of associations and things around the world. And what skills are we demonstrating here? Well, again, there's something about understanding evidence-based medicine, very different to a randomized trial, doing cohort studies, different type of research methodology. And understanding what are the drivers and levers of health policy. So how do we change policy and practice around the world? Quite difficult, usually. So how can we do that? Working with media, that's quite a common thing to need to do in public health. Of course, during the pandemic, people, public health leaders have been more prominent than ever. So that's quite an important skill. Personal skills, again, teamwork, leadership, and time management, because as I mentioned, I was doing this in parallel to the MPH. And just one last example. So at the moment, working in Coventry with the consultants there on a bid to the National Institute for Health Research for funding. There's something called the Health Determinants Research Collaborations. And the idea is that that's going to provide some infrastructure for local authorities to improve their ability to deliver research in the community. And what's that involved has been understanding what are the social determinants of health, because that's the kind of focus of the bid, and who are the agencies involved in that. So who do we need to involve to try to address the social determinants of health? What's the kind of landscape of public health research? What are the priorities? How can we improve it? What are the shortcomings? So how, as we're writing this bid, how can we try and address that? And I think, what is a local authority's role in all of that? So we know these are the social determinants of health. How can the local authority impact on that? What are our levers to try and change things, reduce inequalities, address the social determinants? So again, personal skills, so it's about presentation, because I had to do some presentations to people about this bid, writing the actual bid, quite difficult. Negotiating with partners, so that's been quite an experience, negotiating with our university and NHS partners about how much money they're going to get if this bid is successful. Quite a bit of a sensitive thing to have to do. Liaising with senior stakeholders, so within the council, talking to quite senior council officers to kind of get their input into this bid, get their support. And quite a lot of self-direction, because you're kind of left to do this a lot of the time on your own. It's very different to working in a hospital where you have close supervision, realistically, sort of hour to hour, or there's somebody around. A lot of the time you'll be left on your own to continue with this, and then check in with whoever you're working with every few days or every week, or whatever. So I think hopefully that's given you a bit of an idea of what you can do during public health training, and then backwards a little bit about, well, how might you demonstrate some of the skills that you have that meet the person specification. So hopefully that was useful, but I'm happy to answer any questions. My email's on the bottom of the slide, and of course in the discussion following this. So thanks very much.
Thank you very much, Dimitri. That was very helpful, I'm sure, to many people, and we'll post a couple of links in the chat as well, just to direct you to some useful places to start looking for some of those skills that Dimitri's highlighted. So I'm going to hand over now to Nicola, who is going to chair a sort of further Q&A session. This will obviously be seeing as no one can ask a question with their voice, it'll all be by chat and Q&A. It might be a little bit heavy from the panelists in terms of responses, but please do carry on putting in your questions in the chat and in the Q&A, and particularly if anything that you still think we haven't answered that you want us to go into a little bit more detail, and we'll try and help where we can. So over to you, Nicola.
Fantastic. Thank you very much, Neil. Hopefully everyone can hear me. We're getting a lot of comments through saying what a useful session this has been. So please do, as Neil said, keep sending those questions through. People will be typing, but also I'll throw them to people who I think will be able to answer them specifically. So I'm here because I'm a non-medic as well. So a lot of the questions that we've had have been about work experience. So I just wanted to talk very quickly about that. So I worked in PHE for a long time. So I joined a sender organisation, as they called it, before PHE existed. So I worked I did a psychology undergraduate actually, and then I found a job at a band 4 level, so band 4 maternity leave, which is information assistant level essentially, and just worked my way up from there before PHE existed, and then went into PHE as a band 6 and then worked there for 8 years. So my work experience is extremely linear, but while I was in PHE I tried to do a number of different roles so that I could try and do different things. So I worked for a long time in the local knowledge and intelligence unit, so we worked on the fingertips tools and did a lot of data type stuff. And then I realised that that was quite a narrow focus. So I tried to do some commissioning work I was sexual health facilitator for a year or so. I also did a lot of kind of staff development type roles. So I tried, even though I worked in the one organisation, I was really lucky in that I got to take on a number of different types of role and did a number of different skills. So people are asking where you get those jobs. There's some fantastic websites out there where you can apply for public health jobs. You may not be able to go in at a band 6. You may need to go in lower. I certainly went in lower and worked up. And it does take a while. So somebody asked what the average age is of somebody who completes specialty training. That's a really difficult question because we are quite a diverse bunch of people. Some people go in at a lot older ages. I know people who've gone in sort of in their 40s, and I know people who've gone in their 20s. So it really does vary, and I don't think we can really answer that. But it certainly took me a kind of I worked for 10 years before I applied to the scheme and got on. So it's not something that you can do overnight, and I think it's important to kind of be realistic about that. So a lot of questions as well are about the MPH. So maybe Tessa, if I can pass over to you and you can talk about some of the questions that have come up about the MPH, that would be fantastic.
Hi. So one of the main ones that was coming up was about when you do and do not need to do the MPH. So if you already have a master's in public health, then you probably wouldn't need to do it again. So that would be fine, and you could just start the scheme in the second year. Some other masters may cover the modules that are necessary. So I actually have a master's in control of infectious diseases from London School of Hygiene and Tropical Medicine. And I was given the choice as to whether I wanted to take a public health master's, or I could have gone straight into the second year. So I decided to do the master's, even though I had the option of missing it, because I mean, it's a great opportunity to get paid to learn for a year. And given that you're going to have to take the Part A exam anyway, which is quite a difficult exam and tests a lot of the information that you'll be learning, particularly around stats, I thought it would be helpful to kind of get the refresher to be better prepared for that. And how many times in your life do you get the opportunity to get paid to study, and they cover the cost of the masters as well? So I would actually recommend doing it if you have the choice. But yeah, if you already have covered everything, then you can move straight into the second year. Yeah, so something that also might be an option for those who have studied something similar and are just missing, for example, 1 or 2 modules, is that they could join the second year, but take a couple of modules in that year. But that's something that you would need to discuss with the training program directors to see whether that would be possible with your experience. And I think it would vary depending on which person you speak to as to what they're going to accept in the region that you're in. But yeah, on the whole, I do think the Masters is really useful, so I would recommend it to people.
Fantastic. Thank you very much, Tessa. Hopefully that was useful to a lot of the questions that have come through. I think that was a really good summation of the questions that we've been asked. So thank you very much, Tessa, for that. I did my MPH last year with Dimitri and Gabby, and I completely agree. It's definitely worthwhile doing, and it really does prepare you for the Part A exam. So thank you very much, Tessa. I'm now going to throw to Neil, because we've had a lot of questions about applying from a medical background, and as a non-medic, they're ones that I don't feel in any way able to answer. So I'm going to pass to Neil, who's going to summarise some of the things that we've had come through.
Thanks, Nicola. To be honest, I can't promise that I'll necessarily be in a much better position than Nicola to answer those questions, because unfortunately, eligibility is there's no hard and fast rules. The faculty does that somewhat deliberately to try and keep the kind of eligibility quite broad, but it can make it really difficult to interpret whether you meet those criteria sometimes. In general, you've got the 3 eligibility criteria for the medical route, which focus on either having completed just completed foundation program. So current employment in a UK FPO affiliated foundation program means people who are applying during their FY2 year, or people who have completed an FY2 year within the last 3.5 years from the date of the application, from the date of the start of the scheme starting, or people who've got 12 months of medical experience after full GMC registration, and evidence to commence specialty training. So that basically means that you would be eligible to start any specialty training scheme in the UK. In terms of international applicants, it's quite challenging for us to give any reasonable advice about who is going to be eligible to work. The best place to go is to look at the person specification at the Faculty of Public Health's FAQ, where there's a couple of responses on there. But other than that, to an extent, you'll need to demonstrate for yourself that you do meet those eligibility criteria. And you can try messaging the Faculty of Public Health to clarify those, but we can't promise at this point that they would actually respond in time for the application. So it may be that you apply and see if they will accept your qualifications and justification for this year. Unfortunately, it can be challenging to kind of interpret and demonstrate that, but it is based on, if you don't neatly meet those criteria, you can make an argument to say that actually that you do meet the principles of the eligibility criteria, and so you should be allowed to apply to the scheme.
Fantastic. Thank you, Neil. Can I ask you to answer the question that's come up as you were talking? It says, Neil, may I ask, what did you do during university or foundation training to demonstrate competencies to succeed in securing public health specialty training?
Of course. So as I mentioned before, I applied straight from foundation training into public health training. And I was extremely lucky to manage to get in at the first attempt. And I mean lucky, because I ranked 82nd out of 83 places in a year where we had fewer applicants and more places than usual. So any other year I may not have made it in. So, and so I don't consider myself to have been a particularly strong applicant. You don't need to present a CV or a portfolio. So this goes particularly to medical applicants. It's a little bit different to other specialty training schemes in that they don't directly kind of review a CV. They don't score you on points in the same way. What they do is particularly during sort of interview style stations, that's when your experiences may come up useful. That's where you might get a chance to talk about some of those sorts of things that you've done. And again, I'll just point you straight back to the eligibility, to this person specification, where it will discuss what and the things that Dimitri obviously discussed during his presentation. Look to demonstrate those sorts of things, which for me was audit. I did a degree during med school in global health. But more than that, I also if you're interested in public health, if you read around it, and if you look to apply it in your practice, those sorts of things will also count you in good stead if you can articulate them clearly.
Fantastic. Thank you very much, Neil. We've only got a couple of questions, so please keep sending them in as we talk. And I'm going to pass over to Gabby now, because we've had a question about out of program. So if you have the opportunity to do out of program such as PhD, will this be funded, or do you have to secure funding yourself? If you could talk about that, Gabby, that would be great.
Yeah, of course. For my case, I've secured the funding myself, and it's my understanding that most people have to do that. There are lots of different ways to get into sort of a doctoral training program, or to do a PhD with a specific supervisor. And in my case, I had applied to the Wellcome Trust to obtain funding, and that was a competitive application. And usually that would be how people acquire the funding that they need to do the PhD, because you get your salary through that. But there are other cases where I think, for example, Neil is looking to do his PhD funded through one of his supervisor, and so it's more that you sort of have to be quite proactive in obtaining the funding. It's not that the faculty will pay for it for you.
Perhaps worth mentioning that public health training is quite a good opportunity to do some of the networking, to build some of those opportunities, and also to develop applications. But other than a few months placement in research settings and in universities, it doesn't directly enable you to do PhDs or anything alongside. That would need to be organised all separately.
Fantastic. Thank you very much, both. That's really helpful. We've had a couple of questions about working less than full time. I know that Sophie was here to respond to less than full time questions, but does anybody else have anything they can say about less than full time? So we've got a question: is working less than full time common for caring and childcare reasons? I believe it absolutely is. Like, I know a lot of colleagues who work less than full time, and that seems to work really well for them. But I was wondering if any of the later year trainees has got anything to add about less than full time.
I can say that there's someone in our cohort that started less than full time, so 3 days a week, and so she's doing the masters over 2 years. So I think she's trying to do most of the modules this year in the first year, and then we'll be focusing on dissertation in her second year.
Fantastic, brilliant. And that's really helpful, because there was one question about how you do the masters if you're less than full time. So that's really helpful. I know before I started, I did my masters in 1 year, as did Gabby and Dimitri. But prior to that, it was quite common to do the masters over 2 years, even if you were full time, because you do your other half of work in your local authority. So doing the masters over 2 years doesn't seem to cause a problem at all in terms of actually being able to do that. So hopefully that's helpful.
Might be worth mentioning that with the University of Birmingham Masters, which is what we do in the West Midlands, that the modules tend to be a week at a time. So it can be a little bit challenging just to work out how you do. You might need some flexibility if you want to sort of attend all 5 days of a module, which will be Monday to Friday instead of every Monday for 14 weeks.
Fantastic. Thank you, Neil.
Can I also just jump in and say that there's a number of different justifications for LTFT, but they are now bringing in one which is essentially just a kind of well-being and because you want to be less than full-time, which is really good news. So they are being increasingly flexible for doing less than full-time working.
Fantastic. Thank you very much. I'm now going to pass to Dimitri, because there's a few questions about academic public health training, and it's something I don't really know much about. So Dimitri, I was wondering if you could give us a bit of an overview.
Well, yeah. I mean, Neil is an academic clinical fellow. I'm not, so I'm not best placed. But I can
I'm
tell
actually
you
not either. This is Sophie again, who we've lost, I'm afraid, everyone.
Okay. Well, I can tell you what I think, which is that the guys that started as ACF this year, I think he has taken 6 to 12 months of university time. So he's sort of nominally attached to a local authority, but he's, I think, mainly spending that time in the university. Over the course of 3 years, the idea is that in the ACF, over the course of 3 years, you spend 1 year sort of ring-fenced academic time. And the idea of that is that you use that time to prepare a competitive application for probably PhD funding from something like the National Institute for Health Research, NIHR. So I think it's a great opportunity for someone who's interested in research, wants to try it out, but not quite sure perhaps exactly what research you want to do or who you want to do it with. It's an opportunity to try working with different people in the university. The ACFs are attached to a specific university. So, you know, if you apply to Birmingham, you will be in Birmingham. You can't sort of go off to Oxford or somewhere. But usually within a particular university, there will be flexibility to try working with different supervisors and different types of research. So that's the ACF. In general, the kind of academic career structure is people might do an ACF, then they might do a PhD, and then after a PhD, there are what are called academic clinical lecturer posts, where that will give you more of a 50-50 split between academic, non-academic work. And so that's to kind of start to develop a bit more of a sophisticated and independent research program alongside your clinical training, or, you know, public health training. So the whole concept of the NIHR academic pathways is that they should be flexible, so people can dip in and dip out of that. So if you do an ACF, you're not really committing to an academic career for the rest of your life. You will probably finish that ACF, but then you can go back into the standard training with the rest of us. Conversely, even if you don't apply for an ACF or you're not successful in the ACF initially, there's nothing to stop you from doing a PhD out of program or applying for a clinical lecturer post, for which the sort of essential criteria is that you must have a PhD or before you start that post. So, but if you already have a PhD, you can go into an ACL post. So they are sort of intended to be flexible, and so people do change their track over time if they're interested. So, but you know, if you're interested in more detail, happy to kind of discuss that over email to the best of my ability, or to point you to somebody who can give you more information.
Fantastic, thank you, Dimitri. That was really helpful.
Sorry, I'll just add in as well, as that in public health, because we do have the option to spend some time in university as a placement, that the ACF process isn't as big a, well, it's still a good opportunity, but it's not as sort of important as it might be in a clinical specialty, where it gives you preserved time. So in a clinical specialty, being an ACF means you actually get time out of wards, out of service, to go and do academic work, whereas in public health there are other ways of getting that in the specialty training scheme. So it may, you know, there's a bit more openness to other routes there.
Fantastic, thank you very much, Neil. So we're coming up to the last 5 minutes now, so please do get your questions in. There's another one about academic clinical lecture posts be available to those with a PhD that entered via the non-medic route. Does anybody have?
Yeah, Nicola, so I can, so yeah, so the ACL posts are available. However, those who are interested in that, the NIHR's criteria are that you should be at least SD3 to be appointed to an ACL post. So it would be very unusual and probably wouldn't happen to be appointed as an ACL early on in your training in sort of years 1 and 2. Most people will be appointed in SD3 onwards. And the reason is that they want you to get your kind of core competencies out of the way in terms of Part A exam, health protection placement, etc. So The opportunity is there, it's just a bit later than at the very beginning of the programme.
Fantastic, thank you very much. We've also had a question about training in different regions and are there advantages to training in different regions? And I don't think so. I mean, I wanted to train in the West Midlands because this is where I live, this is where I've worked. I know a lot of people in the system, and it's a fantastic place to train, in my opinion. I've got a fantastic local authority that I work in. The Masters is very good. But I can see that similar things would apply to people all over the country. So I don't think there's like a known, this is the best region and this is the worst region to train or anything like that. So I think you should choose your area based on where you want to be, because you are there for 5 years likely, and it's a big commitment. So if you apply to the other end of the country, you're possibly setting yourselves up for problems if you're going to struggle to move. So very much practically, where do you want to be and where do you want to live? We've had a question about how can we prepare for the assessment day. So Catherine, maybe if I could throw back to you just to summarise your key points from your presentation on that topic of preparing for the assessment day.
Yeah, so the assessment day, I think the best things to use are the job test prep website. So as I said, that is a paid for service, but it does provide kind of the best range of questions for you to use. I think the link that I've put in the presentation takes you directly to the set of public health tests that they have. Would also recommend for people who want to familiarise themselves with the SJT to look at YouTube videos around SJT, and also look at past medical SJT papers, which you can find online as well.
Fantastic, thank you, Catherine. That's really helpful. So we've got questions about, I've heard there's a waiting list for some regions. I don't think that's the case, because I think you start afresh every year. Could I just check with my colleagues that that's true? I can see some nods. So I don't think waiting lists are really an issue. You either get in that year or you don't get in, kind of thing. So hopefully that's true. Do I need to complete CCT to apply for the training, or can I apply as a CT1 from a different specialty? That's one for our medics. Who'd like to take that?
So you would, so if you're in a current training program, you just apply in the same way as anyone else for the training. You don't need to finish whatever training program you're currently on. You can just apply in the general pool, and then obviously you'll need to resign your current training post before starting public health.
Fantastic, thank you very much, Dimitri. We've got 3 questions left in 2 minutes, but I think they're probably more difficult ones to answer. So what happens to your NHS pension at the end of training, i.e. when you're a consultant? It might be a bit early to think about that, to be honest. This is more about applying. I think it will very much depend on what the situation's like in 5 years' time and where you go to work. So sorry, I'm afraid we're probably not the best place to answer that. Is training different in Scotland as they don't have local authorities? Is that correct? Training is different in Scotland, but I'm not sure that's why. Does anybody know anybody who's gone off to train in Scotland? I know we had somebody who's moved.
We've had Aoife Barrow who's moved up recently, yes. So
Absolutely.
the structure of the placements can be different, but the actual the training scheme itself is still the same training scheme, but you apply to through the national system. It's just that the actual placements you go to might be a little bit different because there'll be NHS trusts and boards rather than local authorities usually.
Fantastic. And that's it's just come to 4 o'clock, so that's probably time to stop. So we've got one unanswered question, but we'll make sure that we do come back with an answer to that. But hopefully that half an hour has been really useful for people and you've got answers to the questions that you've asked. So if I could hand back to Neil, who will close the session, I think.
Yeah, thank you very much, Nicola, for facilitating that. I hope that we've been able to answer some of the key questions today. We will make sure that a recording is posted online and shared. So look out for a link which will go from both Eventbrite and Zoom to make sure that everyone gets to see it. In the meantime, good luck with your applications and your future careers. And we will look forward to meeting you on the schemes in the years to come. Thank you very much, everyone.